Welcome. Welcome, everybody. I just want to make sure that my sound is coming through. So if I could get a thumbs up or a wave, that would be great. You should be on mute upon entry, but just in case, you may want to check your sound. If you're connecting to the audio, we'll just let a few more people in. Great. I think our sound seems to be coming through. If not, please just pop your screen on and I'll be able to see that. In the meantime, let me change this that way. Oops, nope, let's go. I was very organized. Now I'm not. Okay, I think we'll just go ahead and get started. Hello, everyone. Welcome to Ellen Wedemire's Pelvic Floor in Pregnancy webinar. We are excited to share this content with you this evening. I'll introduce myself if you don't know me yet. My name is Renee MScPT. I'm the co-host for the evening. I'll be standing by for any questions that might come up. Regarding these questions, there are two options. You can type them into the chat box and I will ask when appropriate, or you are welcome to stay on the line afterwards if you'd like to ask the questions yourself. A little bit about Ellen. Ellen has been with Active Sports Therapy for many years. She joined us in 2012-ish. She started out as a practicum student and then came back as a physio with the specialty in all things pelvic floor. You can find Ellen at AST Willow Park exclusively, and she's always taking new patients. That's all from me. I'll be standing by. Please let me introduce to you Ellen Wedemire. Welcome, Ellen.
Thank you. I'm just going to share my screen so we can start right away with our presentation here. All right, here we go. So thank you so much. This is something I'm really excited about presenting because I have done so many courses over the last couple of years that have really been tailored to pregnancy, postnatal life, how the body changes, how to prepare. And so I've been trying to explain to people what we can do in pregnancy with pelvic floor. And every time someone asks me, it's very hard to put that into a 1-minute answer. So I wanted to put together a presentation that we can see today, we can refer back to, that just kind of explains what is pelvic floor physiotherapy and how does it relate to pregnancy and what do sessions look like in pregnancy and how it can benefit. So thank you for being here. This is something I'm very excited about. A quick kind of background is that recently I took, not even recently anymore, over the last few years, I've taken courses on basically the pregnant body, what changes are happening, how does the pelvic floor change, how does the pelvis change, etc. I took an amazing labor and delivery course. So technically I could be a doula at this point if I wanted to, but I chose to take that information into clinic, and I'll talk about it later, but kind of train you or your birthing partner to help you and be your doula for you, a little mini doula, if you will. And just lots of courses on how the body changes, but what we can do to optimize those changes and go forward after pregnancy. So we'll dive in here. Like Renee said, if you have any questions, please throw them in the chat box. Honestly, there's not many of us live right now, so feel free to interrupt as well, and we can just kind of stop and go in as needed. So firstly, we'll get into, for those that don't know, what is pelvic floor or pelvic health physiotherapy? I put both in because they're very interchangeable. You'll see some pelvic floor physios say that, or they'll say that they're a pelvic health physio. Basically, what we do is we're trained in not only the pelvis, but all of the surrounding areas. So we have the muscles on the bottom of the pelvis that you can see in this picture, or with my handy pelvis. This is new, I'm very excited about it. And so we have all sorts of muscles. If this is our bony pelvis, muscles that are inside, as well as muscles that are outside. So those, we want to look at the strength, the control, the endurance, how we're able to use those muscles. We also want to think of the muscles that are around the pelvis. So we have our glutes that are on the back, we have rotators in through our hips, we have the thighs that come down front and back, we have our low back, you can see the spine there, it's all connected. So we look at all the things that are related to the pelvis and how they kind of intermingle to let us move. We also look at things like movement patterns and bladder and bowel habits, which is huge. So things like incontinence, which we think of either bowel or bladder, or things like frequency, which is peeing a lot, or urgency, which is having to pee right now. Anything that's bladder related is generally going to be within our wheelhouse. We also look at pain, and that can be pain in any of the areas that I mentioned, but things like pain with intercourse or pain to touch areas that are in kind of the bottom of the perineal area or the front of the pelvis or the back of the pelvis or the SI joints. That's kind of all within the scope of pelvic health or pelvic floor physiotherapy. So you can think if those are the areas that we're focusing on, then we're pretty good people to get involved in pregnancy, because those are the areas that are changing the most as you become pregnant, as you go throughout that pregnancy, and you're changing a lot. And then postnatally, because then we're changing again. And so I was trying to kind of put things together, and this was the way that I could really sort things into categories. But the four best benefits, I guess, in doing pelvic floor physio while you're pregnant is that, number one, you can sort out any underlying issues. So that can be if you're peeing a lot before you're pregnant or early in your pregnancy, that's going to increase once you have a little human sitting on your bladder. And so you want to try to get that sorted out beforehand, or at least get it under control, maybe figure out why it's happening, kind of get the process going before you're later on, so that you can have a normal frequency. That's just one example. It could also be pain that you already have. It can be movements that are kind of funky that you're noticing. It could be incontinence, prolapse, any of those things that could be already happening that could then be affected by your pregnancy. So to get those sorted out first. Then we want to optimize that pregnancy. We're going to get into this a little bit more as I go forward. We're going to prepare for labor and delivery, and then we're going to prepare for postpartum. And so those are the four areas that we kind of want to focus on in your pregnancy to try to optimize pregnancy and beyond. So, like I said, first we want to sort out underlying issues. Bladder frequency is a common one, and that's what I tend to see. People will come to see me before trying to get pregnant because they know that that's in their plans, and they're like, oh my gosh, there's no way I can pee more than I pee right now. Please help me. That's a really nice one. Another one is common, and I didn't realize how common it was until I started practicing, but it's where if I say squeeze, you actually relax. And when I say relax that pelvic floor, you actually squeeze. We call it reciprocal use of the pelvic floor. And so usually that's fine. Sometimes it can lead to incontinence or prolapse if needed. But when you think of later on in labor, when people are asking you to push or you are trying to relax, we want to make sure that the pelvic floor is listening to you. So sometimes it's nice just to have that initial assessment to know that you're in control in the right way. And if that's something that's underlying, that's usually a pretty easy fix. All right, then we have optimizing pregnancy. Now, again, I could probably make a whole other hour-long presentation just on this, but really big parts of what we can do in pelvic floor physio to optimize that pregnancy is deal with pain. We call it pelvic girdle pain. So that pain is basically anything that's part of that pelvis. So if we bring this pelvis back, we have our pubic symphysis. You may have heard of it. It's this little bit. It's kind of like a little pillow that's sitting in between our main bones in our pelvis. This is what dissolves in labor so that your pelvis can open up and allow baby to come through a little bit more. And then it comes back. It's really cool. Women are awesome. But sometimes in pregnancy, we can see pain happening at this point. We can also see pain occurring around the SI joints, which are where the spine and the pelvis meet. And then anywhere in through the rest of the back or pelvic girdle, also anything kind of on the sides. So what we know through a lot of amazing research that happened in the last 5 years is that pelvic girdle pain is not necessarily related to tight muscles. oftentimes there's a lot of things, we call it a biopsychosocial component. So yeah, you might have some tension, but then you might also have a lot of anxiety going on. You might not be sleeping well. You might have stopped moving because you're exhausted because you're pregnant. You might be having some issues with maybe the other parent or people in your lives, and all of those things come together to create pain. So what we can do is actually get you on a really safe movement pattern that can help decrease that pain and get you in control, which is really cool. So that's one big part. So I've seen a lot of people that have that, and we just get you going, and then it's all about control in that, and knowing what your body needs and being able to give it that. So that's an amazing way that you can optimize your pregnancy if you're having a little bit of pain. We also have diastasis rectum. And a lot of people will have heard of that, especially if they are watching pregnancy TikTok. It is all the rage right now. And basically what it is, and we'll see it in this picture, is it's a separation of your abs. So if we're thinking of our six-pack abs, they generally look pretty close together. But as we grow a human, that little baby needs space, and they're going to start growing outwards into your bump. But eventually there's no more room. And so we need those abs to separate a little bit. Biggest thing that I can say is diastasis in pregnancy is normal. There's a lot, like I said, TikTok is kind of going the wrong way at this point. Some people are really amazing, but a lot of people are getting very obsessed with that diastasis and that separation. But I have never met a pregnant woman who doesn't have a bit of separation, because they need room for baby. And if we think about it, that little space that's in between, that tissue is kind of like silly putty. So we stretch, stretch, stretch. And then afterwards, postnatally, sometimes we can come back together, sometimes we don't. But no matter what, it doesn't have to be a problem if we are controlling it appropriately. And that has to do with breath, that has to do with our pressure system in through our abdomen. If we are not breathing properly, if we're applying too much pressure through the abdomen, then all of that pressure is going to try and come out the weakest part, which is our silly putty. And so we can start to actually control that through different exercises, movements. A big one, this one you might see on TikTok, this is correct, is that we don't necessarily want to be getting up off the couch forward. We don't want to be doing that crunch action. Instead, we would want to be rolling onto your side and then getting up from your side. That way we're not applying undue pressure. So that's just one example of how you can start to control that diastasis appropriately so that your pregnancy is great, and then postnatal, you'll hopefully be in a little bit better control as well. On that note, what we can also do in pregnancy is try to figure out how to change workouts, what workouts to continue, what do we maybe work away from, and how do we replace them? Because as you grow through pregnancy, your needs are going to change. And sometimes you're just kind of sitting there scratching your head and you're like, I really want to do push-ups, but I have a giant belly in the way. What can I do? Or should I be doing chin-ups still? The answer is usually no, because of that diastasis. And so there's ways that we can modify to make sure that those that want to be incredibly active can be incredibly active right till the point of labor. Or if people are really struggling, what 3 things can we get you doing in a week to make sure that you maintain activity? So all of those things really help with optimizing that pregnancy to keep you going, to keep the body moving, and to respect the changes that are happening in that body. So if we go back to our benefits of pelvic floor physio and pregnancy, we also want to prepare for labor and delivery. And this is my new baby, is prepping people. And I will say that this comes from an area where I know that for me, when I'm pregnant, when I'm trying to deliver, I'm going to want to know as much information as possible. And that's just who I am, type A people. And so when I was learning all of these things, I was getting light bulb moments left, right, and center. And I was like, why don't people know these things? And so that is what has become sessions. And I'll discuss those sessions later on in the presentation. But things that we can do in advance to prepare the body so that it is ready for labor. I should say it's already ready for labor. We are built to be able to give birth to babies. and our bodies will do what they can naturally. This is to allow you to be a little bit more in control of the situation. Again, if you're anything like me, you just want to know all the things possible. And it gives you options on what positions you can go into if you've already practiced them. It gives you options to know what is safest for your pelvic floor, what is not great for your pelvic floor. So the first thing that we do, if I know that you're pregnant, if we know that we're kind of working towards that labor delivery, if we're just simply assessing, we're always looking for pelvic floor tension and the ability to relax. So we know, again, if we have that little pelvic floor, so we have our little hammock here, baby is coming down head first, right into here. So what we want is those muscles to be able to give way and allow baby to come through that vaginal canal. Because it's hard to show on this, but the vaginal canal is actually quite small. And it's right here, but we have so many different muscles in through there as well. And we want your body to be able to relax them. A lot, again, I'm going to say research all the time because research is important, but research is showing that if you have a very, very tight pelvic floor, then baby just kind of starts ramming their head against there. And we don't necessarily get the appropriate responses by mom's body to allow everything to start going and to really get the labor process going. So we want your body to have the appropriate tension, but not too much. So that's something that you can get going during your pregnancy, which is awesome. Like I said, learning about the process, positions, options, it's so nice. I have sheets on sheets right now to give people about biomechanics, about what the pelvis does, what the baby's doing as we go through, so that you know, and then you can plan accordingly or choose not to plan accordingly, and that is totally up to you. You can practice labor and delivery positions, which is really cool. It's nice, just like if anyone's ever played sports, it's nice to practice what you know is coming, so that when you're in the game, it's just natural and it feels good and you don't have to think about it too hard. I know no one wants to be thinking during labor. I don't want you to be like, I need my pelvis to open this way, so I should be in this position. No, it should be, this feels good. I know my body likes this. Let's do it. So you're able to actually practice those, especially in that last trimester with a ball or a partner or a coach or whatever. So it's really nice to be able to do that in advance. Same with breathing techniques. We've all seen all the crazy movies and shows with the screaming and the whispering and all that stuff. It's nice to be able to actually practice different breathing techniques, again, so that you know what you're going to want to do maybe when you're in labor, or you have a whole bunch of different options that you can cycle through if nothing's really working for you. Also preparing the tissue for delivery. I'll get into that a little bit in the future, but basically we're trying to just prepare your body. So there's different stretch and massage techniques, not necessarily to stretch you out and remain open, but to allow the tissue to understand that it can safely stretch. And so it can help with pain, it can help with control, and potentially help with tearing as well. All right, last thing that we can do in pregnancy is actually prepare for postpartum. And this is huge because you can see it at the bottom. It is much easier to relearn something than it is to learn in the first place. So we'll always be assessing your strength and your control, your ability to basically hold pee when you're pregnant, so that when you're doing your postnatal rehab, you're basically just reminding the body what it has already done in the first place. So it'll likely be learning some sort of exercises. Unless you're brilliantly strong, then you'll probably be fine. But generally, it's nice to at least have that control. It'll allow you to get in touch with that pelvic floor again. So postnatally, when things kind of shut down a little bit, it'll be easier to get back that connection. So I love for people to be able to get in touch with that pelvic floor when they don't have a baby right beside them, when they have the time, especially for first-time moms, to be able to really get in touch, so that when they are trying to do things postnatally, it's so much easier. All right, so on that, when should I start? And this is a really important one because we don't want to see anyone in their first trimester. Not because it's dangerous, but we know that unfortunately the first trimester has the highest rate of issues. That is where sometimes we can see miscarriages. That's where there are problems. Also, you're probably exhausted. And so generally we say once you hit that second trimester, come in right away. anytime after 12 weeks. Because if you come in earlier, if you come at week 14 and we get all the way to week 40 in your pregnancy, that is so much time if you do have things that you need to work on. If we did discover that you don't have great pelvic floor control, you have so much time to work that out. If we did discover you're really, really tight, you have so much time to breathe and relax and get control of that situation instead of coming at 30 or 35 weeks, which is still fine and definitely better than not going, but it just gives you more opportunity to improve if needed. So this is the big one. What do sessions look like? Now, the initial appointment can sometimes surprise people because it's going to be longer. It's going to be an hour, hour and 10-ish, depending on kind of what's going on. But there is a giant stack of forms that I'm going to ask you to fill out when you, I guess, sign up or book in for an initial assessment. These forms are the same with any pelvic floor physio person. So it's not specific to pregnancy or incontinence or whatever. All my patients are going to be filling out the same forms. They are long and they are tedious, and I always apologize, but it is so nice because when you fill those out, we ask you to get them in before your session. And then I go with my awesome purple pelvic floor highlighter and I go through and I write myself notes and I put stickies on there so that we can really tailor the conversation instead of me having to pepper you with 400 questions, because that's no fun and it doesn't really give us the answers that we need. Now, they are quite long because the pelvic floor is impacted by so much in the body that we might not think of. So you might be like, I'm literally just coming because I'm pregnant and someone told me to come see you. And I love that. That's totally fine. But in the forms, I'm going to ask, is it ever painful to have sex? Do you ever have any leakage? Do you ever feel any heaviness? Do you ever have any bowel stuff? We're going to get into some mental health stuff, other injuries, and it might feel very random, but it's because all of those things play into the pelvic floor, and we might notice something that you can sort out that you didn't even realize could be sorted out, if that makes sense. And a lot of times it also allows us to get into why something might be happening instead of kind of playing guess and check. Or if we chat about it and we get to it in the 5th session, that's totally fine, but it's nicer when we know it in advance. So there's very long forms so that we can get the whole story. After the forms, we have a very long chat to discuss the very long forms. And again, that is because we want as much information as possible. I had a wonderful assessment, not with a pregnant patient, which is another pelvic floor patient on Saturday. And we kind of looked at each other and we took up 55 of the 60 minutes of that session just talking. But we knew exactly where we needed to go with things. At that point, we had an amazing plan. We were figuring stuff out left, right, and center, like, oh, we're putting things together. It was amazing. And that means that the following sessions are going to be so smooth. And so I like for people to know that the initial assessment sometimes is talking, and it feels sometimes like you're getting gypped, but that conversation is oftentimes way more important than any assessment that we're going to do, because it's going to help us put pieces together way more quickly down the road, and it'll help you kind of overall. So I like that to be there. I know every pelvic physio is different. Some people will jump right to assessment. Some people will do the forms with you or kind of ask you those questions. Some people do what I do. We all just kind of figure it out our own way based on how we practice and where we see the most success. So in that initial appointment, it might be a long 55-minute conversation, or it could be a 10-minute conversation. And if it is, then we're jumping right into assessment. And that assessment is now going to be very specific to your situation. For most pregnant women, that's going to look like optimally an internal assessment as well as an external assessment. Depending on timing, I'll oftentimes get to all the external stuff on day 1, and then we'll do all the internal stuff on day 2. But again, totally depends. And that conversation is really what's going to lead us down the right path. So that physical assessment, externally, we're going to be looking at a whole bunch of stuff. And so again, I like to say that because some people are expecting internal right away. That's all we do. And it's really not, because you're a whole human. You're not just a bunch of muscles on the bottom of your pelvis. So we want to make sure that we're getting everything. Now, what we'll look at is alignment. Alignment is really cool because if you think of a woman going through pregnancy, we start no belly, not you, like you're normal and you're like that for a little while. And then belly starts to grow. And as the kind of lay population, that's what we notice is the growing of the belly. But the hips are changing, the rib cage is changing. We start to see the rib cage actually coming up, so baby has more space, but that's going to change your ability to breathe. You can see on the bottom there, breathing with a bunch of stars. The way that we breathe is how we control our pelvic floor, how we control our core, and in that case, how we can actually control how our back muscles are moving, glutes are moving, all that jazz. And so we're going to want to look at that alignment, but we are expecting your alignment to kind of go funky on us in second trimester, third trimester. And then it turns into, how are you able to move? Are you mobile through the pelvis, through the rib cage? Obviously, we don't expect perfect alignment, but could we maybe get there postnatally because things aren't locked into one place? So alignment totally depends how we assess it based on where you are in your pregnancy, based on how big baby is, how big your bump is, what is going on in there. Also assessing diastasis. Like I said, totally expected. We expect to see some sort of separation. What we don't want to see is what is called either doming or coning. Same thing, you'll just see people call it different things. And that's basically where if you do something and you look down, there's a little tent going right down the middle of your abs. And that means that all of that pressure is coming out where that silly putty is. And that is not great because it means that number one, you're going to be putting a lot of pressure through there, which can actually increase that separation unnecessarily, which can make postnatal life a little tougher. And it also means that you're just not using your core properly. So oftentimes, depending on where we're at, we'll likely look at, are we getting a little bit of doming or coning? If you're a very fit person, we're probably going to jump right into explaining how we can avoid that in your exercises. In general, we're going to talk about positions and exercises and whatnot that you can do to avoid it, or maybe you have none, and that's not something you have to worry about at that point. So again, everything, assessment, treatment is all going to be dependent on what we talked about, what we did. So everyone's going to be different, but these are common ones that we'll see. Likely also looking for tension, again, depending on what we talked about. We can look at tension anywhere. How are you using your muscles? Movements like squats or balance or whatever we need to do based on what you're noticing so far in that pregnancy. Breathing is a big one. I'm going to be looking at how you're breathing, and then that will also likely dictate how we're treating. Breath is going to be super important because that is how we relax the pelvic floor, and we're also connecting the breath to how we contract the pelvic floor. So breathing, usually if we only get to one thing other than talking in that initial assessment, it's probably breathing because it is really the cornerstone of everything else that we do. So if we did the external assessment, then we go into the internal assessment if you're comfortable with it. And technically part of that internal assessment is external. And that is because we have pelvic floor muscles that are on the outside that we don't actually have to go into the vagina to feel. We have them, so if this is our, hair all over this. If this is our spine, so this is the back, front is down here, then we have muscles that go around the anus. We have muscles that then, now we're at the front, come from the pubic bone, basically, out to the side under our hips. We have muscles that go under the labia, and we have a super important muscle that is between the vagina and the anus, and then it goes out to the sides. That guy's important because we want him to be able to hold everyone up inside. So always going to be checking those guys first before we go internal, because if we have a lot of tension there or a lot of sensitivity or tenderness, that might be something that we sort out before we even go internal. Because if this is really tight or uncomfortable or anything like that, there's a good chance that going right internal is not going to be a good time, but we need this to be a good experience. Then what will happen is I'll go internal as long as we're okay with that. And the way it works is, if this is the vaginal opening, we'll go in with one finger first. What happens then is I'm going to turn that finger with a lot of lubricant, so no worries. And I'm going to be pressing on muscles. And this is my way of being able to assess tension. I'm always feeling the bounce back of the muscle. how the muscle's responding to touch. So sometimes we'll get little spasms, sometimes it'll be nothing, sometimes something in the middle. And I go by a clock. And this is how most pelvic physios are taught, because it's easier to chart that way. It's easier to make sure that we know exactly where you were tight one time, be able to get into it the next time. But we'll be going through and basically going down and then going a little bit deeper. So the first time it's usually just I'm trying to use physio terms, the knuckle. The farthest knuckle away is going to be the only thing that's in. And then we're going to go a little bit deeper and then a little bit deeper, because we have so many different muscles. But again, you might do the first set and you're like, I'm good. And that's fine. Always up to you on what you want to do. But tension is first. Then if I notice tension, we're probably going to go right into treating that, because we know that when muscles are already tight, it's really hard to get a full contraction out of them. So if I assess strength in a really tight muscle, I'm not getting the correct response or the correct feedback. So we're probably going to treat. And the treatment is really cool because it's so easy. All I'm doing is I'm putting my finger right on that tense part. Sometimes it's also tender, sometimes it's not. And then you're breathing. And that's why the breathing is the cornerstone. Because as you inhale, we elicit a natural relaxation response of the pelvic floor, as long as we're breathing properly. And so that natural relaxation paired with my specific telling the body that this is what we're really paying attention to, along with decreasing our fight or flight response with a slow controlled breath, will actually allow that muscle to just relax and let go. Because most tension is neurological, all tension is neurological. And so what we need to do is calm down that response to whatever it's responding to. And so it allows that muscle to go back to its resting state. And the reason why it's so cool is you feel it. As the patient, I feel it too, but especially as a patient, it'll be tender, and then all of a sudden it's not, or you'll literally feel the muscle let go. And so oftentimes we'll just sit on it until you tell me that it's gone, or if I feel a really dramatic release, I'll ask. But it's the coolest thing. I never believed it until I got assessed, and I was like, there's no way. And it's so obvious, and it's very, very cool. So usually if we find tension, we're going to want to get rid of it right away, which is awesome. Then instead of just having one finger in, I'm going to be slipping a second finger in, as long as you're okay with it, and then spreading those fingers out just a little bit, and we're going to assess strength. And all that is squeezing and lifting. Because the pelvic floor is like a little bowl, when it's relaxed, when it contracts, it comes up. And so this is our relaxed state, this is our contracted state, and we just kind of work back and forth like this. And so when you're squeezing, I want to feel a squeeze and a lift, because that means we're using the muscles really nicely. Sometimes it's just a squeeze, that's great, but it just means we can get a little more control in there. And we're also going to be looking at the strength in different ways and control, because we have muscles in the front, muscles in the middle, and muscles in the back. And we want all of those muscles to be working equally together as one unit. But what oftentimes happens, especially in women, we're all bad for this, we tend to have stronger posterior, the back of the pelvic floor. And it's generally because we're really good at holding our farts. And so we're constantly using those muscles in through the back. So they get a workout all the time because we are all just very polite. But the ones that are really important, because we're also more predisposed to things like bladder incontinence, those are the front muscles. And so if we have a super strong back of the pelvic floor and our front isn't quite as strong, we're just going to keep using the back as a compensation without knowing it. And then we can get leakage, which is annoying. So what I'm doing is I'm going to assess, are you able to use the front? Are you able to use the middle? Are you able to use the back isolated? And then can we increase strength somewhere so that when we're using everything together, it's perfect. And that is always the goal, right? Is for everyone to be playing their part so we can do things as well as we can. So that's part of it. It's not just a simple squeeze and lift. We want to make sure that we're actually using the right part of the pelvic floor when we're trying to hold something back, for example. So always looking at that. That's the control bit. We're looking at endurance the same way we look at strength, just for longer. And tenderness. We can get tenderness externally, internally, very specifically or very broadly. And we want to know that before we try to push a baby out. So oftentimes what we can do is actually control that tenderness. You can feel so much better before that situation so that your birth is a lot smoother, and especially postnatally will be a lot better. So that is what the physical assessment looks like. Like I said, that could be over one day, that could be over 3 days. We might not get to some of that because we don't have to. We might just focus on 2 of those things. It's all very specific to you, which is how it should be. We don't want to be doing things just for the sake of doing them. But those are ones that I tend to see most frequently, especially for women who are pregnant. And honestly, I tend to do most of these things, even if you're not pregnant, just so that we know what's going on in that pelvic floor. All right, then after we did that, what do follow-up sessions look like? And the biggest thing is you basically get to show off what you've been working on. So if you were working on relaxations and you have homework, I'm going to give you homework. I'm a homework-based physio. Unfortunately, it's very mean, but that's how we get the best results. So after you do your homework, then you get to prove that you did it, and we get to see the changes. So that might be breathing every day to relax your pelvic floor. And then we get in there and see how that works. Your homework might have been to use the front of the pelvic floor exclusively. And so we might go in there and check. And if it's working, yes, we're either going to progress those exercises, we're going to graduate from them and do something else. We might reassess and be like, you're good to go, which is always fun. That's the best session ever. And so we're always just looking at what you've been working on and then progressing that. Or we might be looking at something else. So sometimes we want to look at a lot of things together at the same time because they're so intertwined. Other times we see what's going on and be like, okay, first we're going to work on relaxation. Then we're going to work on strength. Then we're going to do some bladder training, maybe. Then we're going to get you doing functional movement. So squatting and step ups and stairs while being able to contract your pelvic floor or relax the pelvic floor. So there's usually some sort of progressions or changes, and that's always really fun. The other thing that could be happening is we could be doing manual work. So just the same way as if you go see a massage therapist or your chiro or your physio for your ankle or whatever, likely they're putting their hands on there. And if we have tension or we have issues, we're going to be doing some sort of manual work. So in that case, we might go right back in there with that finger, with the breathing. We're going to find those areas of tension and get them to relax again. Unfortunately, usually it takes a few sessions in order to relax muscles, again, the same way as it would for any other part of your body. But it's always really nice to see those changes. And that's why we chart so thoroughly, so we can see, okay, last time when we were at a moderate depth at 3 o'clock, there was a lot of tension and tenderness. And then today, there was only a little bit of tension and tenderness. Score, you're doing it right. I'm hitting the spots. We're on the right track. So oftentimes, the follow-up sessions look very similar to the part of the assessment where we found something. And we're just kind of retrying and then changing up exercises as needed. So now we'll get into specific sessions. And this is the exciting part. This is what I love. And it's very specific to pregnancy because really all those other things we just do in pelvic floor physio based on kind of whatever you came in with. This stuff is very specific to pregnancy. And this is stuff that I have kind of put specific sessions at specific times together to tackle the important parts. And a lot of this stuff comes later on. So earlier on, we're just checking, is there tension? Is there strength issues? What can we sort out? Are you having pain? Then we sort out the pain component. But once we get to around 30 weeks, then it's go time. This is where we start to make some big changes. So one session that I really love to do, and you don't have to do it, but I've gotten some really good feedback, is a labor and delivery prep session. And this one's really fun because you can bring in your birth partner. That doesn't have to be your actual partner. That can be your mom. That can be whoever you're planning on having in the delivery room. And this is where they become your doula and they understand what's about to happen. Because let me tell you, partners usually have no idea what's about to happen. And that can really affect their experience and their ability to support you. So this is where we sit down. I bring out that pelvis, I bring out my peanut ball, we have all sorts of stuff going on, and we will go through biomechanics. we're going to go through, we call it the baby's dance. It's really cool because the baby starts coming out face down and then actually turns and then comes out face up, which I just think is the coolest thing in the world. And it's nice to know what's going on because there are parts of labor where you're supposed to slow down. And a lot of us don't know that. And that's where oftentimes we get like instant, like, okay, we need to push Pitocin, we need to induce, we need to jump to C-section, whatever it is. But sometimes it's just that the body needs a break. And so it's nice as the birther, as well as the birthing partner, to be like, okay, I think we're good. We're just gonna take a chill pill here. We're fine, instead of panicking because you think that everything should continue to progress. That's one small part of labor where it's nice to have a little bit of information, and it's nice to have your partner know that information so you don't have to think about it when you're in the middle of labor. So we go through the whole 9 yards. What does early labor look like? What does pushing look like? What should you expect from pushing? What are different ways we can push? And we'll go through what's actually happening with our lovely pelvis, because this little sneak peek, early on in labor, I guess, as baby is descending, since baby's coming from above, we want to open up the top part of the pelvis. We can do that with certain positions. And then as baby continues to descend, then we want to start to shift the pelvis this way. And then at the end, we actually want to be closing the top to open the bottom, because each bone is kind of like a little lever here. And so whatever is happening at the top is the opposite is going to happen at the bottom. So there are so many different positions you can be doing in labor to help baby through and help baby get prepared. And there's ways that you can tell kind of where you're at. And again, these are things that are nice to know early so you can practice. You can practice. There's 2 positions right there that are using actually the peanut ball that I'll talk about. And so you can practice being in those positions early so you know for a fact you hate this position. There's no way you're going to go into it. Don't try it when you're in the middle of labor. There's other ones that feel so comfortable. So you're like, okay, at least I can try while I'm there. So I love that. So it's nice to kind of have an idea of what's going on. All of that being said, some people don't want to know, and that's also fine. Sometimes it's just like, doctor's going to tell me to do something, I'm going to do it. I love that. It's whatever you are most comfortable with, as long as you know what your options are, really. And if you're someone who likes a lot of information, let me give you all the information. All right, so that's usually a session. The labor position prep is really nice. It's where we go through all the different positions that you might want to labor in that you should prepare in advance. So you're basically, after 30 weeks, instead of necessarily doing yoga, you could be doing these different positions. And there are things that you might be asked to do during labor and delivery. It might be things that you want to get into. And it's just nice to be able to go over all of them. Sometimes, depending on timing, we can do that in the labor and delivery prep. It's nice when partners are there because sometimes they're involved in some of these positions. But totally depends on kind of timing and whatnot. We also have the peanut ball. I didn't think to bring it. It's at the clinic, but it basically, you can kind of see it in this picture on the bottom. It looks like 2 mini exercise balls that are put together. And it's usually about this tall-ish wide. And what's really cool about the peanut ball, other than amazing research that says that it's wonderfully supportive, it allows anyone to move into different positions in labor, including those that had an epidural, which is fantastic because we know that movement during labor and switching positions is one of the best things you can do. Previously, on another slide, I forgot to mention it, I had the lady giving birth on her back in that back lying position. It's not optimal. It's not the best position to be in. It's easiest for the doctors because it's easy to catch baby, which is awesome, but it's not great for mom. And so it's nice to have options, again, to practice. And the peanut ball is one that lets you relax in these different positions so you're not holding yourself up. So generally, I'll go over all sorts of peanut ball stuff, again, if you want. One of the last sessions that we're going to do, this is usually anywhere between 34 and 36 weeks. Earlier, if you feel like baby's going to come a little earlier, but 36 weeks is the most common. I'm starting to recommend more 34, but it doesn't matter. Later on in pregnancy, we'll do a session where we're going over perineal stretching and massage. So the perineum is basically the area including vagina and back to anus, so the bottom of that pelvic floor. And so if we have our vagina here, we have a baby that has to fit out of there. So all of the tissue around it has to be able to stretch in order to allow baby to come out. Now, when we work on stretching these muscles and the tissue and the skin and everything around it, the purpose, like I said before, is not to create this gaping hole that doesn't come back. That's not how our body works. The idea is that we do a very specific stretching technique that will allow you to get used to a certain amount of stretch and then build on that. So we're just preparing the tissue to be ready for birth. So is specific stretching technique, again, it would take a while to go through it now, so we're not going to, but it's basically using your fingers and thumbs or a partner's fingers and thumbs to stretch the tissue in certain directions for a certain amount of time in order to get your body ready. It doesn't necessarily prevent tears, so I wouldn't want to lead anyone astray. It's not like if you do your perineal stretching, you for sure won't tear at all, but a lot of research is showing that it prevents high-grade tears, which are the ones that are now coming into muscles, which are the ones that tear into anus. So more grade 1 and 2 tears instead, which is great. That's just the skin or the tissue around it, so that heals really nicely. So it can prevent those high-grade tears, but it also just gets your body ready. It helps with that pain and panic response. It helps with your recovery from it because you won't be as sensitized to it as well. So it's a really important one. Again, all of these things are things that I learned and went, I am so happy I know that for when I give birth. So I'm trying to make sure that everyone else has that information too, because really that's our responsibility, right? Is to help each other and make sure that everyone has the best experience. So those are very specific pregnancy pelvic floor sessions. Now, every pelvic floor physio is going to be a bit different. We all have different training. I have a lot of training in the pregnancy, labor, delivery department because that's what I was super interested in. And so I sought out those certifications and those training sessions. Other people might not, and they're more in the incontinence realm or whatever, and that's totally fine. So these are the things that I do. Other people might not do that, and that's totally fine. You just want to make sure that if you're looking for that, you know that the physio kind of goes over those things. And obviously, I would never force anyone to come see me. Just please tell anyone who's pregnant to just go see a pelvic physio. It's just lovely if it's me. Okay, so those are the pregnancy-related appointments that I would do, and some other physios will do as well. Now, I always feel like this at the end where I just threw a lot of information at everyone, but was there any questions?
There was a question that came up, and the information is more than welcome. It's such great information. There was a question. I'll read it as it was written. Do you suggest a personal trainer? This was going back to when you were speaking on exercises. Do you suggest a personal trainer be certified to work with pregnant women at any stage? If not, what do you suggest that trainer does best to help their client?
Obviously, certifications are awesome. If you have the option or opportunity to work with someone who is trained in pregnancy exercise, then that's the best. The issue is that, how do we word this? Some certifications are better than others. So just because someone's certified doesn't necessarily mean they're perfect for it. So I like the second part of that question is, what should they be doing? So you will know if your personal trainer knows what they're talking about if they're watching how you're breathing. They're recommending that you're breathing through every exercise, which I recommend to everyone. We never want to be holding our breath, especially when pregnant. And if they are watching for that coning or doming that I talked about. So for one, I know how to exercise. I have a lot of training in it. I hate creating programs for myself. So I would love to have someone tell me what to do. And that's what I would be looking for is if you have someone, they don't necessarily have to have this epic certification. If they know the knowledge behind it and they are looking at your breathing patterns and they're able to modify to make sure that you're not coning or doming, that's the biggest thing that you're looking for. And then if there's issues, for them to be able to recognize that and then send you maybe to see a normal physio or a pelvic physio or whatever as needed, and then continue. So I love the idea of having a personal trainer, especially for that concept of just being able to show up and have someone to tell you what to do. So definitely highly support. But if they are in the pregnancy realm, then there's a greater chance that they're going to know what to look for and help you be able to modify, because there's lots of modifications out there. We just want to make sure that you're moving properly. So yes, I guess. Yes to personal training. Just make sure that they have an idea of breath work at the very least.
Do you have anyone that you would refer to, Ellen?
Yes, thinking that. I don't have anyone right now. I had someone and then they moved.
Okay.
So that's going to have to be my homework. See, I give homework, I take homework.
I can look into that as well. It really got me thinking too. So I'll ask my trainer some questions on that, and then maybe follow.
Yes, that would be wonderful. Thank you.
Yeah. This is more of a personal message. I'm not seeing it along there. How can pelvic floor physio help when one has a breech baby, whether they know it or not? Is there things that you can kind of forecast and see if baby is breech and help assist in the turning or monitor?
But it's a little bit, most of that is out of our wheelhouse, but there's a good chance that if you know the baby's breech and you're kind of not early, because most babies will flip around and be in all sorts of crazy positions up till 36, up to 38 weeks. So we don't want to be too concerned. But a really nice thing that you can do in most cases is an inversion. And so the idea behind inversions, which is basically any position where your head is down and your tail is up, is that you're actually bringing baby up and giving them space so that they can do their little somersaulting and get into position, because babies are trying to get head down 99% of the time. And oftentimes, if they're breech, it's because they got stuck somewhere. And sometimes that's because a foot is sticking out in a weird position or whatever. But sometimes it's because things are too just tight together down low. And so they tried to come through and now they're just kind of hanging out sideways. So inversions, which is part of one of the kind of labor positions, can actually train your body to be totally fine with having your head down so that you can take the time as needed to get baby to hang out in the right position. I have seen actually quite a few situations in the pelvic floor world, we always talk, where people had to go into an inversion during labor because baby was doing something funky. They were dancing the wrong way, basically. And so they had to come into a head down position to allow baby to reset and try again. And thankfully, this patient had been trying inversions because they were preparing for labor. And so their midwife was like, can you stand on your head, basically, with knees on the couch, which I can't imagine doing while laboring. But she was like, yeah, no problem, because she had already been practicing. So that's definitely one. And what's nice too is, I don't know if people know, we're trying to do vaginal breech births if possible, especially at South Health Campus. They're all set up for it, which is really cool. And that does mean that baby's going to come out kind of funky. So the more you can relax the pelvic floor and the more you can control the pain, the better your situation. So by being aware of your anatomy, being able to consciously relax, by practicing your breathing patterns, that can actually help a breech delivery, vaginal delivery, go a lot more smoothly. And I know the OBs really appreciate that because they have a teammate as they're going through things. Good question. Forgot about breech birthing.
Are there any other questions? I'm not seeing any written down, but if there are, go ahead and speak up. If not, Ellen has another two. Oh, there's your slide.
Yeah, that's just a quick one. I didn't talk about my future ones, but this is my email. It's very easy. Ellen@activesportstherapy.ca. And I love questions, so feel free to use it as needed.
And I believe I mentioned it, but I just want to follow up just in case I didn't. Ellen, you are at Willow Park exclusively. That's right. the AST Willow Park. You'll be able to review this whole video on our YouTube channel, Active Sports Therapy 1, which is great if there's things you missed or something you want to share with a friend. There are actually, as Ellen said, how many part physio, sorry, I'm stumbling on words today. I was saying this earlier on to Ellen. How many part pelvic floor physiotherapy, like you did a series last year. Was it a 5-part or was it a 6-part? I'm trying to remember. 6. Yes. So you can also find all of those videos on our YouTube channel, Active Sports Therapy 1. I think that is all for now. Be sure to keep your eye on AST Monthly for the next pelvic floor physio during pregnancy webinar that's coming up, I think February 20th. Is that correct, Ellen? So we'll have all registration details and topic details and at our AST Monthly. I think that's all though. Thank you so much for everything, Ellen. That was amazing as usual. And thanks everyone for your time and attention. We very much appreciate the support and know that Ellen's here for you during your future pregnancies or current pregnancies or anything else along the way. So have a great night, everybody, and we will see you soon. Take care.
Thank you so much. Bye-bye.
Bye now.